Hello, ladies. Everyone prepares for labor, but very few people prepare for what happens after the baby arrives. Today, I'm sharing my favorite postpartum hacks that can make those few weeks easier for you, make it more comfortable and less overwhelming for you. This is Care and Counsel with Emma. You're welcome. We talk about women, we talk about everything that pertains to women, whether you're in your early 20s, early 30s, middle age, older age, perimenopause, menopause, whichever level you are in life, we have something that will benefit you, especially coming from the mental health standpoint of women. So, here we talk about a lot of things. So, if you're a woman that falls into any of this age, in fact, once you're a woman, you must see something you will benefit from here. And if you're a man that loves women, you have women in your life, you're a father, you're an uncle, you're a daddy, you're a friend, a husband, whichever one you are, things are here for you that will help you bring out the best in those women in your life. So today we are talking about hacks that will help you postpartum, that is after delivery, when the baby is here with you. Things that are going to help you have life easier and live a better life. So the first thing on my list is food. I'm sort of a foodie, so I like food. So here, the first thing is about food. So you know how we talked about that when ladies are pregnant, that sometimes they prefer eating what other people cook. So, but this is not exactly the case after delivery, because your taste buds are coming back to normal now. So you would be able to eat things that you were rejecting when you were pregnant and all that. But the thing is that you might not have time to be cooking. So when your partner is not there to help, probably he's working or you don't have a partner available to help, but probably you don't have grown up family members to help as well. What you could do ahead is to make food and freeze. Freeze foods, soups, stews, dishes, breakfast burritos, muffins, and many other things that, depending on your menu and the things that you eat, you see, that are freezable. Freeze them so that by this time you wouldn't have time to be making whole meals again like you used to do, especially when you don't have adult help around to help. So you can warm those food and eat. And when you're making, if you have a family like younger children with you as well that you need to feed, put them into consideration this period and make things that will go around for the family. Sometimes order in. Sometimes, just you have ready made foods or half cooked food that like maybe white rice that you can just turn into stir fry or stuff like that, so that you would be able to feed without stress during this first few weeks after the baby has come, and even probably up to a month or two. It depends on how big space you have in your freezer and how much you can handle. So the tip here is, as you're cooking when you're pregnant or as you receive food gifts, just throw them in the freezer, throw them in the freezer, throw them in the freezer. As you remain have leftovers, or you consciously cook extra when you're pregnant, and remove some portion and freeze. Remove some portion and freeze. So that by the time you have your baby, you have stored up food that you can eat. Yeah. So the second thing on my list is making a bedside postpartum recovery basket. Yeah. So in that basket, you would have pads, you would have a peri bottle. There's this bottle that is shaped this way that you could use to wash yourself after weeing or pooing, so that you can wash off and not have issues with infections. Yeah, you could have pain relief depending on the ones that were prescribed to you. You can have nipple cream if you're breastfeeding. The cream helps in cracking. When your nipples are cracked during breastfeeding, you could use that to cure them. They are okay for babies to suck and all that. Just make sure you're using the right thing, that you're not the one recommending for yourself if you're not knowledgeable about it before now. You could have water bottles in there so that you don't need to be walking around and looking for water all the time you need water. Snacks, healthy snacks, nuts, fruits, oats based snacks and stuff like that. Lip balm and your phone charger. So you should have like a basket like that so that you can keep that basket beside your bed or carry it around wherever you need to go to in the house. So that way you don't have to be looking for these necessities. You just have them with you always. So they should be within arm's reach wherever you are. So create nursing stations around the house. So this is where you feed your baby, whether you're breastfeeding or you're feeding with bottle. But nursing station means where you feed your baby. So create several areas in your house that are comfortable for you to be able to stay and feed your baby. Comfortable means it should be soft and firm at the same time. So you could have a chair, you should have a stool where you can lift up your leg so that your leg is not always on the ground. It helps to lift up your leg so that it will help with the drainage of the fluids that have accumulated in your body while pregnant. Yeah, so that they don't stop at your feet and make your feet swell. That also applies in pregnancy, lifting up your feet. So you create those places that are comfortable. If you're a Christian, you can keep your Bible there, or keep your devotionals there, or keep books that you can read. So while breastfeeding baby, you can also be relaxing. Things that give you joy, books, music, whatever, you can keep them around the breastfeeding station or the nursing station and use them while breastfeeding. Just create a comfortable space for yourself. That's what I mean there. So the fourth one is that you should accept help without feeling guilty. Yes, women, we love being strong. We love, showing that we are strong, most of us. So this is not a time to show strength. Like I said in one of the videos of pregnancy, being strong does not mean refusing help. In fact, it takes a strong woman to accept help. So this is a time when you actually need help. So you know people that are genuine. You should be sensitive. Follow your heart. If you're not comfortable with anyone coming around you, then don't allow those people come around you. But the people you're comfortable with, allow them help you. Encourage families and friends to wash dishes for you, hold the baby while you have a bath, fold your laundry, bring meals. Like if they want to cook food and bring for you, why not? I know your mommy said you shouldn't eat people's food when you were younger, but now you're older and wiser. You should know the people you eat their food and the people you don't. So allow them bring meals, those ones you eat their food. Allow them grocery shop for you to help you buy things that you need for the house. Allow them. Even your partner, sometimes you might think, oh, I don't want to stress him. I don't want to this. I don't want to that. But you're in this together. So there's no harm in asking him, baby, please, can you help me buy this? Can you help me buy that when you're coming back from work? Can you help me do the shopping so that I can cook? And if he knows how to cook at all, he should be helping you cook also so that you can get some rest. Because you've been on a long journey. That's what they call it where I come from. And you just return. So you need some rest and some space. Yeah. So the fifth deal is that you should wear comfortable clothing. Comfortable clothing means clothing that is not too tight fitting, clothing that will allow you, breastfeed easily if you're breastfeeding. If you're okay with nursing bras, myself, not nursing bras didn't work for me. So if you're okay with nursing bras, get nursing bras and use. If you're okay with your own bra, go ahead and use them. Wear loose clothes that will allow your body breathe. Robes, if you have robes, you can use robes. Use high-waisted underwears. If you have this binding thing, you just bind. If I get the picture, I'm gonna put it up somewhere here so you can see what it looks like. So when you're done giving birth, it will be nice to use it. Even if it's surgery you used, you can ask your health practitioner to ensure that it's okay to do that. So you just use it and hold your tummy. Not tight, just to hold it in place so that it doesn't keep wriggling about and causing you discomfort, you know. And with time, you start getting used to holding it by yourself and holding it in. Yeah. So you need that. You need this helps you with speedy recovery. Wearing loose clothes that are not, don't make you hot, that don't make you uncomfortable. Yes, you need all the comfort you can because your body needs to be relaxed as well. Stay hydrated. That is the sixth point. Always stay hydrated. Drink fluids that are healthy. And fluids that are healthy include water and water and water. So if there's any other fluid that you're okay with, maybe milk, yogurt. Yogurt is good for breast milk production. Those kind of drinks that are non-alcoholic and are not packed with sugar. Because sugar is also not good for your baby, too much sugar. So drink moderately. Let me put it that way. Yeah, whatever you're doing, do it in moderation. I wouldn't say stay away from everything completely, but whatever, like the things you like to do them in moderation so that it will not have any adverse effect on you or your baby. So use products that you can easily handle with one hand, whether it be your breast pump, your bottle warmer, your baby carrier, whatever devices you're using while to attend to your baby. Try and make it things that you can operate with one hand, that you don't need both hands to operate. Because most times you might have baby on one hand and you need to use the other hand to do them. Yeah. So learn baby wearing. Use carriers, use wraps. There are some wraps that are used in carrying babies. I think now babies are quite young to carry on your back, so the ones you should be using are mostly the ones that hold the baby in front of you. So there are different types of carriers and baby wraps that you could use to hold the baby in front of you, so that you can, while baby's head is on your chest, it's going to be comforting for the baby, so the baby doesn't cry all the time. And then you can go ahead and do some stuff that you need to do around the house, you know. Yeah. So while preparing meals, while taking walks, doing light chores, and it's gonna help the baby feel close to you. Some people will say, "Oh, don't carry your baby all the time. Don't allow the baby feel you all the time. It's gonna make the baby attached. It's gonna." But I'm telling you, as a psychologist and as a mom that I am, I hold my children close. I hold them close, and there's nothing wrong with that. You listen to your baby and see what the baby wants. If the baby is the one that needs the attention, give the baby all the attention. With time, the baby will start, become secure and start, wandering away and doing things. But if you're always denying the baby of that attachment, denying the baby of that security, because the baby is going to feel secure when the baby knows that you're there with them, and it will give them the leverage to be able to adventure, do adventure. But when the baby is always scared that you're going to leave them and run away, you're going to dump them and run away, then that is where the baby becomes even more attached. Like attached the way we see attachment. That baby that is always fearful, that doesn't want people around them and all that. Most of them come from this kind of relationships. So there's nothing wrong with wanting your baby to be close and giving the baby the attention. As far as go with the baby's cue and see what the baby wants at every point in time. So the 10th one is lower your household standards, your housework standards. Many of us are perfectionists. You want your house to be spick and span. You want everything in its place. You want this, you want that, you want that, you want that. This is not the season to be a perfectionist. This is the time to stay alive and make sure that you give the best to yourself and to your baby. If you're not okay yourself, you will not be able to give to a child, the newborn child. So you need to be well yourself. So prioritize your healing, prioritize feeding baby, prioritize sleeping both for you and your baby, eating well, and everything else can wait. So you mustn't start cleaning up, and when people are in the house, ask for help. Ask them to help you clean up. For now, you don't even need to be bending over and doing some things. You don't need to be doing strenuous things. You need your body to heal. Your body has gone through a lot in the 9 months. And even in the 1 hour or 2 hours or 24 hours or 36 hours that it took for you to labor and bring forth that child, your body has gone through a lot and needs time to heal. So prioritize your healing, prioritize feeding baby, prioritize your sleep, eating, and everything else can wait. When people come around to the house, ask for help. If they don't offer, ask for help. And if they do offer, don't be a good person and be saying, "Oh, thank you, but I'll be fine." That No, you won't be fine. Actually, accept the help and allow them help you clean up. And you that is going to visit a lady that just gave birth, what are you doing? Expecting them to cook for you and serve you and make pounded yam and a mighty soup for you to eat. Who are you? And if you're a lady, shame on you, because you know what childbirth means. And you're expecting another lady that just gave birth to do all that for you. That's not nice. You should actually be the one asking, "Can I help you cook? Or should I cook from home and bring for you? Is there anything you want me to do for you? Do you want me to clean up? Do you want me to..." Even if they don't, even if they say they don't want to, insist and do it for them. You're sowing seed for your own. If you've had your own already, you're sowing seed for your children to come. Yes. So keep healthy. Don't say, "Oh, let me relax now. Baby has come." Yeah, we normally add weight after childbirth. You don't need to add that weight. You don't need to starve yourself either. So just keep healthy. When you feel hungry, eat right. So how you can achieve this is by keeping snacks that are healthy around you, so that when you're hungry, you have something to eat. These are include nuts, fruits, yogurt, cheese sticks, boiled eggs, protein bars. These things, you can just keep them around in the fridge, beside you, your bedside, your chair side in the living room, wherever your nursing stations. Just keep them around, so that when you're hungry, you'll be able to pick up the right thing to eat. You wouldn't start going for junk food by that time. Yeah. And sometimes we nursing, I'm not a nursing mom, no. So sometimes new moms actually forget to eat because they are so busy attending to the baby and trying to calculate things and do many other things. So just eat a little at a time, a little at a time, so that you stay nourished and filled up. Yeah. So the next thing, that is number 12, is keeping baby supplies on every floor. That is, if your house has different floor levels. So you keep baby supplies up, keep baby supplies down. This actually helped me at a point in my nursing period. It really, really helped me keeping things up and down. So that way you don't have to be running helter skelter to get baby's things. So you have your diapers, your wipes, your bob clothes, your extra outfits for the baby downstairs and upstairs and wherever else stairs you have. So you just keep them handy, so that whenever you need it, you don't need to be running up and down. You just have it beside you. So if you don't have extras, like maybe you have just one wipe in the house at the time, you can just have a bag where you put baby's changing stuff. So when you're coming downstairs, you carry it downstairs with you. And when you're done with downstairs and you want to go upstairs to bed, for example, you carry it up with you. That way you have everything you need handy for you at all times. Yes. So the 13th one is protect your mental health. Your mental health is important to us, sister. So there are so many things that happen to a lady after birth in your body and also in your mind. So we'll be talking about a lot of, I'll talk about baby blues and what it means, and postpartum depression and what it means in the next episode that I'm going to be doing. So baby blues and postpartum depression, I'm not going to be going deep into them, but these are the things that happen to women. Sometimes people say, "Oh, she has run mad, she has become mad after giving birth." Sometimes, in fact, it is not madness, it's not sometimes. Sometimes your mind plays tricks on you. you would see your baby and your baby is looking scary, looking like a monster. Sometimes you see your baby and you feel like throwing the baby away. Sometimes you feel so sad, you feel so weepy all the time. These things are either baby blues or postpartum depression. We are going to talk about them and differentiate them in the next video. So these times, these things are things that occur after a lady has given birth. Not to all ladies, but to some ladies. And there are many things that cause them. So we are going to be talking about them also. So remember, we talked about asking for help. Ask for help. Talk to ladies that have had babies before. Don't say, oh, I'm too embarrassed or too shy. You'll be surprised. All the people around you might have gone through that experience. So it's okay to talk to people, trusted people, of course, not anybody that you just see. If you could talk to the medical professionals as well when you go for visits and ask them about things that are bothering you so that they can give you advice. Take breaks. Sometimes you don't want to stay with the baby. It's okay too. Ask your partner to hold the baby or any adult in the house with you. They should handle the baby while you take some time off for yourself. Talk to your partner, express yourself. Sometimes one thing that happens to us in relationships is that we always assume. We always assume the other person knows. We always assume the other person knows what we are going through. The other person knows how we feel. But it's not always the case. So if the other person is acting or actually does not understand us or does not know what we are going through, it is for us to verbalize it in a loving and kind way so that the person can understand and be of support to us. Yes. So if any of the symptoms that you're going through in your body, like after the delivery, maybe you're feeling pain in any part of your body or stuff like that, also feel free to discuss with your healthcare provider, and tell them how you feel so that it can be solved. It could be just something that just needs you to do something differently, or it could be something that is complicated. One thing you should do is don't ignore your instincts. So number 14 is start a simple night routine. Prepare before bed. So fresh diaper, fresh outfit for the baby, your water bottle, everything that you put in that in the nursing station should all be taken with you to the bedside so that you don't start searching for things at 2 a.m. or whatever time you wake up to feed the baby. You're always ready. You always have things ready. Your snacks, your water bottle. Water is your friend at this time because you need all the hydration you can get. Because breastfeeding takes out a lot of hydration from you. So you need to replenish that. Yeah. So give yourself grace. That's the final point. Don't be too hard on yourself. It might be your first time of having a baby. It might not be your first time, but for every baby you have, trust me, it's a first time for you because every baby comes differently. Every delivery is different. Every pregnancy is different. So every baby has their own personality and has a way you need to treat them for you to get the best out of them. And your healing comes in different phases too, in different pregnancies. Yeah. So take time to be patient with yourself, show yourself grace. The recovery, for everything about recovery, just take it easy on yourself. Even being relaxed about it will help you heal faster. Being anxious, being desperate, being perplexed about it, allowing yourself to be worked up about it will delay your healing, I'm telling you. So relax and take every day as it comes. Relax and be happy about it. Whatever you're going through, remember to share with someone that is trusted that could help you. Also, you could search on YouTube and look for videos like this that are going to help you, navigate this season. Yes. So if you have had experiences after your delivery that you would want to share, please go to the comment section and talk about it. If some of the things I said here resonate with you, please talk about it in the comment section. And if you have any questions, feel free to ask in the comment section also. Have you liked this video already? Have you subscribed to this channel? If you found value in this video, please go ahead and subscribe and share to other people that you feel it will benefit as well. See you in the next one.